Hi, it's Dr. Dawn, Chicago's own board certified OBGYN. My mission is to empower women of all ages with strong medical knowledge and proactive sexual education that will optimize their physical and mental health, thereby strengthening their self-esteem and motivation to achieve more for themselves. Welcome. I'm back again here today. Today I am continuing my talks on fibroids. If you all tuned in yesterday, you remember that I wanted to talk about this because I have several friends or friends of friends who were diagnosed with fibroids and had different endpoints because of that. So I want to talk about it and talk about some of the options we have for ladies that have fibroids. One of the fibroids are symptoms of fibroids, which mainly can be heavy vaginal bleeding, chronic pelvic pain or pressure, and pain with intercourse. Fibroids, as we discussed yesterday, are just really cells or muscular cells of the uterus that grow on top of themselves, and they form tumors. Tumors are not necessarily cancerous, but they mean that these cells are growing on top of each other. So like I discussed yesterday, the tumors that are fibroid in nature can grow. They can be as small as a pea or a marble, or they can be as big as an orange, a grapefruit, a cantaloupe, or a watermelon. And they're found inside the womb, which is the uterus, in women. They can be found towards the inside of the uterus, in the thickness of the uterus, walls rather, or on the outside of the uterus. Either way, most of the times when they're there, they can cause symptoms if we don't take care of them. Not always, though. So, like I said, this talks I began talking about these things because the women that I know of were having the main complaints of heavy vaginal bleeding. So that means that they were either having really heavy menstrual cycles lasting 7 to 10 days or more, or they were bleeding even outside of their menstrual cycles. And that's because if the fibroid is located on the inside of the uterine cavity, it just kind of bleeds irregularly. So what happens? What do we do when we get those symptoms? And does that necessarily mean we have surgery? And the answer is no. It really depends on how those fibroids are representing themselves. So now yesterday I was going through the questions, and one of the listeners asked questions such as, if you have fibroids, do they sometimes shrink? The answer is yes, but it depends on your age at the time. Most of the times, the fibroids are responsive to estrogen, and estrogen is a hormone that's naturally found in the bodies of women. So as long as you have estrogen on board, the fibroid potentially can grow or get bigger. They don't always get bigger, but they can. Hey, Tower, thank you for coming on board. So when the fibroids do shrink, it's usually because the woman does not have the high levels of estrogen. And that's either because the woman is going through menopause, or if we give them medicines that shut down the hormones so that the fibroids do shrink. So let's say you've been diagnosed with the fibroid, and your next question is, okay, what do I need to do? Once you talk to your doctor, the doctor will probably do imaging, either an ultrasound or a sonohystogram or an MRI, to determine where the fibroid is located and how large it is. So let's say the fibroid is found and it's in the wall of the uterus, and it's maybe, most of the times we're talking about centimeters, ladies. So let's say it's 3 centimeters. So that's maybe 1.5 inches. That's not that big. And depending on where it's found, that might even not be a problem for you. So maybe an incidental finding that we notice because your doctor's been doing your pelvic exams and they notice that your uterus is a little enlarged. Most times the smaller fibroids really don't cause symptoms. It's when they get larger that they can cause symptoms. So what are some of the symptoms that you might have? One of the main things we said, like I said, was the vaginal bleeding. It could be irregular, it could be heavy, and the reason that's a problem because it can lead to anemia. I have been in the hospital where ladies come in and normal hemoglobin levels for ladies are about 12 to 14, and they may present and come to the hospital because they have had vaginal bleeding and their hemoglobin level is at 5 or 6. that is a problem, ladies. Typically, you will notice that and you'll feel it because you'll feel really tired, fatigued, no energy, little energy. And most of these ladies that came in and their hemoglobin was 5 or 6, they had those symptoms. And typically, if you get that low, we have to give you a blood transfusion because we really want you, like I said, normal is 12. Most ladies are going to sit at 9 to 10. So the vaginal bleeding, like I said, or these fibroids can just get bigger and bigger and bigger and bigger. Again, I've been doing this for a little while now, so we have ladies that come in and they look like they're pregnant. So typically, if you are pregnant, we come in and we can tell how far along you are just by how large that uterus is above the umbilicus or your belly button. And ladies can sometimes have fibroids that hit their umbilicus, which means it's a 20-week size, and it's just all fibroid. There's no baby there. Now, of course, when they get to that size, then we need to do something. So hopefully, most ladies are going to present to their doctor's office before they get to be really big, and we can do some things to help you out. Now, I mentioned yesterday some medical treatments that we can try for you, especially if you're just having vaginal bleeding and they're fairly small and they're not really large enough to cause you pain. So sometimes we'll use the birth control pills to help you with that. Depending on where that fibroid is, if it's not in the inner cavity of the uterus where the baby grows, we can even sometimes give you a Mirena IUD. The Mirena IUD has the progesterone, the hormone progesterone in it. And so that tends to thin out your uterine lining so that you have less bleeding. Sometimes, or a lot of times, it doesn't work with ladies that have fibroids because when they get big enough, they can really encroach on the inside cavity of that uterus, so you really don't tolerate it or it really doesn't fit. So one of the other options that ladies have is to have what we call as a uterine artery embolization. So what the uterine artery embolization is, every organ that your body has blood vessels that go to it, that feed it and sends oxygen to it and takes deoxygenated blood away. So what happens is the main arteries that go to the uterus are called the uterine arteries. You have main arteries and then you have branches of it. So what we'll do is we'll put in small little plastic beads. They're microscopic, but they go in and they block the main arteries to your uterus. And so because it doesn't have the main blood supply to it, they can shrink. Just like I talked about earlier, if you don't have the hormones to feed it from the estrogen, well, if you don't have a blood supply to it, they also will shrink. So a lot of times ladies will have a uterine artery embolization, and that will shrink the fibroids inside the uterus down to a size that potentially they are not giving you as many of the symptoms that you have. So this is a same-day procedure. You can have a lot of bleeding and some pain afterwards, to the point where you will need ibuprofen or maybe even a codeine product like hydrocodone, codeine, Tylenol 3, things like that. But this is a good option for ladies who are kind of that in-between stage. They don't really necessarily need surgery, but they do have symptoms, it's getting bigger, and they want to do something to help them for that with that vaginal bleeding. So let's say that this person goes and the uterus is really big. So when I say big, I'm talking about it's up to your belly button or even higher. It's causing you a lot of pressure. You're constantly feeling bloated. You have pain with intercourse because, hey, Dr. Donna, of course we know the uterus is connected to the cervix, which is the neck of the uterus. So, and that's connected to the vagina. So with intercourse, you can have pain if that large uterus is full of fibroids and you're having discomfort during it. So worst case, or not even the worst case scenario, but one option would be to have some type of surgery to help you with these fibroids. One type of surgery that we have is called specifically a myomectomy. A myomectomy is when we go in and we take that fibroid out of the uterus and we close that area back up. So if it's on the inside of the uterus, we can do it with a hysterectomy, which is a little device we use. We go in, it has a camera, and we basically just shave that fibroid down until it's flush with the cavity. So you may need that a couple of times, but that is a myomectomy that we can do through the hysterectomy. We also can do the myomectomy that's traditionally open or through the laparoscope or the Da Vinci. The Da Vinci and the laparoscope are the same type of devices where we go with small tubes that have the instruments that go through them. We cut and snip and cauterize and do everything through the small tubes. And the benefits of that is that the tubes fit in incisions that are like a centimeter. So you may have 1 or 3 or 5 small incisions instead of a large one. If you're not a good candidate for the laparoscopic myomectomy, you will have what's open, where you have the larger bikini cut that we typically see, and they will take that fibroid out and close the area up. A lot of times ladies will opt for the myomectomy as opposed to something different or further when they are still in the childbearing age and they want to retain their fertility, so they want to keep that uterus there. So if we know that we have younger ladies, then we will go for a myomectomy, which is just removing the fibroid and leaving the uterus in place. Hi, Shaka. So let's say you've gone through the stages, you've tried medical therapy, you've tried birth control pills or the IUD, you're not a good candidate for the uterine artery embolization, and the final thing that we look at is a hysterectomy. So what is an hysterectomy? An hysterectomy is when we take the wound of the woman or the uterus of the woman out surgically. So if we take that uterus out, as you all remember, I said you got your uterus, and then you have the neck of the uterus, which is, you don't have to see my Fitbit. The neck of the uterus is the cervix, and then it's connected to the vagina. So that's all what you're looking at. And then you have these little fallopian tubes on the side. On the side of the fallopian tubes, you got this ovary sitting there. So when we do your hysterectomy, we'll take in this uterus out, and most times we'll take out the cervix too. We used to sometimes leave the cervix, but we know that we can have cervical cancer. So a lot of times if it's not surgically a problem, we will take out the cervix with the uterus. That's a hysterectomy. That doesn't mean we take out these little ovaries that are on the side. And depending on what your history is and what's happening in your age, we may opt to leave the ovaries there, because we know the ovaries make estrogen. So if you don't have estrogen on board, then you go through menopause. So let's say you're having all these issues and you're 38. Maybe you've had, hey Simone, that's my cousin, y'all. She's here supporting me. Let's say you're 38, you've had 3 kids, you know you don't want to have any more kids, and these fibroids, you've tried different things and they haven't worked for you. So you may opt just to have a hysterectomy that takes the cervix out and leaves your ovaries in place, and then that's it. Most of the time, if it's open, you need about 6 weeks out. If we can do it with the laparoscope, hey Camille, or Da Vinci, maybe 4 weeks or so, and it really just depends on the size and if your doctor is really experiencing and doing it that way. Now, depending on your age or your history, let's say your mom has a history of ovarian cancer, or you had a history and you had a cyst taken out that was borderline. You take those ovaries out. And again, so you have the hysterectomy and a oophorectomy. So a hysterectomy does not mean you take your ovaries out. The hysterectomy means you're taking out the uterus. And a lot of times we'll say a hysterectomy bilateral oophorectomy, meaning that we take out the ovaries on both sides. So that is the end result of ladies that have large fibroids, and they are symptomatic and they don't necessarily respond to medical therapy. And we've tried myomectomy, we've tried the uterine artery embolization, and that's not working. Then the end result is a hysterectomy. And I talked about it because, like I said, I have a lot of friends that have had to, unfortunately, been going through these symptoms, and they ended up having to have a hysterectomy, or have a friend of a friend who had the hysterectomy. So I counseling you guys like I would counsel my friends. So that is it for now. Hi Olu, thanks for joining. That is it for now. Talked about fibroids, and I want to thank you guys for coming and joining. Hopefully you learned something from this. If you did learn something, please share my video. And I am on all social media, Twitter, Instagram, Facebook, YouTube as Dr. Dawn OBGYN. That's Dr. Dawn with an E, OBGYN. So check me out, like my pages, follow me on those modalities. I am going to have an audio book that's going to be available really soon. The book is on conversations on contraception. If you guys realize, or if you know, I did a lot of talks on contraception options that I think are really informative. So if you're interested in downloading that, just hit me up on Facebook and leave me your email and I can send it to you. So that's it, guys. Thanks for tuning in. It's Dr. Dawn OBGYN, Chicago's own board certified OB, and I will be talking with you all again on Monday at 5 with a topic to be determined. Thanks, guys. Bye-bye.